My glasses are hella dirty. Also, what the hell is my computer doing? It's not even hot. Let's try this again now that my computer's done updating. Hi guys, my name is Sam and I make videos about makeup, chronic illness, and whatever I want. And today I want to talk about my first round of migraine Botox. Before I get into the actual Botox, I want to talk about what led me to this treatment in the first place. I started getting migraines more frequently a few years ago, and so I went in, had an MRI, started treatment, and things were going pretty well until the beginning of this year. In January, I ended up in the hospital because I was not responding to my migraine medication, and it was causing such severe GI issues that I could not stop throwing up. So this led me to kind of riding it out and hoping that was a once in a while situation. And while I didn't have any more episodes of severe vomiting, I was continuing to have gastroparesis really severely. Prior to this year, I was not having gastroparesis at all with my migraines, and it's not uncommon to have it. It was just something that I had never personally had with mine. And because that became more frequent, the abortive medication I was on was just not working because I wasn't digesting it. So how that worked out was my migraines were not going anywhere, they were lasting longer, and they were happening more frequently. I would say once I started my medication and I went on a preventative, I was getting like 4-ish a month, which was a huge improvement because I was getting 11 a month before any medications. Fast forward to this year, on a preventative medication, I was getting about 12 to 14 on a preventative medication. So in September, I went and saw my neurologist and explained what was happening, and a couple things went down. We discussed an updated MRI. I wanted to hold off to see if a change of medication worked first. Like, we switched my abortive medication to a dissolving one, so I didn't have to worry about the gastroparesis. So I wanted to try that before I did another MRI, just because I didn't really think anything was significantly different brain-wise, but it was on the table just because they had changed so dramatically. And then the other thing that was on the table was changing preventative medication and getting Botox pre-approved to give that a try. So my Botox was approved quite quickly, literally within 2 days, and then I was scheduled a week later to do my first treatment. The unfortunate thing about having migraines that frequently was I lost like half of this year. I was majority housebound and quite literally unable to do anything. All of my chores were neglected. As you could see, YouTube uploads were basically unheard of at that point. I've barely touched makeup this year. I have gained a significant amount of weight because I was unable to move. I was just in so much excruciating pain and getting sick so frequently that life just went on without me, basically. I am happy to say that things are looking up with the Botox treatment. First, as I mentioned, I'm on the dissolving abortive medication and it's working fantastic. Well, I'm glad I don't have to take it as much because of the Botox. It is definitely doing its job better than the last abortive medication. So if you're unaware what Botox for migraine is, it's a series of about 30 injections into your head and neck and like your traps, so like upper shoulders. That sounds terrifying to have 31 injections into you, but it's a fairly small needle and it goes really quick. They're not injecting like a lot of substance. So the location is along the forehead, between the eyes, up the base of the neck, like right here above the ear, and then along your traps. I was a little worried how my body was going to respond to this, so I did a bit of like preparation. I made sure I ate a decent, mine was in the morning, so whatever meal was before. I made sure I ate a decent breakfast so my blood sugar wasn't low. I took both something salty in case my blood pressure dropped and some orange juice in case my blood sugar dropped. I wore my compression hose to make sure my blood pressure didn't drop. I took one of those like emergency ice packs. You like break it and it gets cold just in case the whole blood pressure situation. I tend to get incredibly flushed. Oh, I made sure I was really hydrated. I took an electrolyte drink with me as well. Now, thankfully, nothing happened. It was fine. Was it fine because I prepared really well? Or was it fine because it was just fine? I don't know. I imagine, like, you just want to be hydrated and fed no matter what you're doing. But so I guess I'll say it was a mixture of the two. But you know what I mean. There wasn't just like one trick, I suppose. I'm sure some of you are curious, like, how much did it hurt? And I could say it didn't really hurt at all. The ones between the eyes were probably the worst, in my opinion. It's mostly just like a pinch. It doesn't last very long. Like, it stops hurting as soon as they're done. But, like, those ones made my eyes water the most. Other than that, it was fine. Like, the back of the head and the neck and the traps I didn't really feel, but she said I didn't feel them because it's so ungodly tight back there that is why. But it was nothing compared to a migraine, but it also just wasn't so bad in general. Like I said, just kind of like a pinching sensation. Not quite as bad as like getting your ears pierced, but it's definitely noticeable. Let's talk aftercare. There are some things that you have to do after every injection session, not just the first one. You have to stay sitting upright for a minimum of 4 hours just to make sure nothing migrates. We'll talk about that, the cosmetic effects in a minute. You don't want it to migrate, especially on your face, because that could cause some issues. But it can also cause it to not work, even in the back or side of your head, if it doesn't have time to settle into the specific muscles and nerves it was injected into. The first night you need to sleep on your back for a similar situation, because you get them in the side of your head and your face. You don't want to like push those around, especially the face. It's mostly the face ones for sleeping on your back, because we'll talk about the cosmetic effects in a moment. It did set off a migraine for me, but it wasn't too severe. That was something they warned me about, and I expected it. But at that point, I was having migraines most days of the week, so it wasn't new to me anyway. I did hear that is something that will taper off the more sessions that you have had. So that's just how it went the first time. I did take a nap after about 4 hours. I was pretty tired. I'm not sure if the fatigue was from the injections or just from the migraine itself, but I have heard a lot of people do get sleepy. As for that, there is a chance you could get something called the Botox flu. It's usually more common in your first couple of rounds, from what I've heard. I thankfully did not get that. What it is basically what it sounds like. You just feel kind of crummy. I have that occasionally with vaccine. Every once in a while, I will just get like super fatigued after like my flu shot or something. The COVID injections in the beginning, I definitely had that, like chills, tiredness, whatever. You can get that from the Botox just as your body is getting used to something being injected into you. Like, it's completely normal. It'll go away. It's not going to be severe. But I did not have that. I felt totally fine the next day. As for my improvements, after 2 weeks, I noticed a drastic decrease. I noticed a pretty quick change in severity, but definitely the frequency changed like 2 weeks. Now, I do want to sidebar that not everyone has the same outcome in the same time. There are some people who notice the effects right away. There are some people who it takes 2 to 3 sessions to notice anything. 3 sessions is when you will know if you pass or fail Botox, meaning it's working for you or it's not working for you. And 3 sessions is when you'll notice like full performance, full benefits. Something that's interesting that has been happening, which is something she said most of her patients experience, is I will get what I have been calling fake migraines. Is I'll get all the prodrome symptoms. So I'll get the excess yawning, the fatigue, the mild stomach issues. It's not full gastroparesis, but it's definitely slowed draining of the stomach. I'll still get the aura. I'll still get like the stuffy nose on whatever side, and I'll get like the neck pain and stiffness. But quite often, it won't go past that. It won't go into a full-blown migraine. It's like a false start almost. It's very interesting, and I guess as time goes on that will decrease as well. So that is pretty interesting. I never know exactly when I'm going to get a full migraine or when I'm going to get one of these like false start migraines. So October was my first like full month because I think I went on September 29th. Yeah, I think the 29th was my first set of injections. And so we just passed a month. Well, we're actually almost at 2 months now. I have lost track of time. But I went from, like I said, having probably like 4 to 5 a week on preventative medication to October. I had 3 full migraines in the entire month of October. So it's definitely working. I'm very excited to see like the full benefits because I'm like getting my life back. Now let's talk about the least important part of this, but something I want to add because I didn't really know much about it beforehand. The cosmetic effects of medical Botox. This is not meant to treat cosmetic issues. It is not placed or injected into a place that necessarily targets cosmetic problem areas, but it does. So the first thing is I want to try something different when I get it the second time, and I'll make a video discussing how it works. I did not think about the eyebrow situation because my brain was just focused on the fact this is medical Botox. Yeah, some of it went in your face, but I didn't really think much about it. I'm going to mess up my beautiful bangs right now to show you like the situation. So there were, I don't know, 4 shots here, maybe 6. I don't know, somewhere between 4 and 6 shots here. I'm looking at myself. So like you can tell, my forehead is incredibly smooth. I mean, I have like acne scarring, but my forehead is incredibly smooth and it doesn't move at all. Now let's get to the part I really didn't think about. It's wearing off a little, so it's slightly less drastic. Some of my friends have seen this already, so it's not weird. I'm also used to seeing it. Excuse me. I'm used to seeing it now, so it might not look as drastic to me anymore because I'm used to it. But when it kicked in, which is somewhere between 7 and 10 days, I was kind of like shocked and like disgusted. Also, I don't have any makeup on my forehead and I didn't do my eyebrows because I forgot I was going to show you my forehead. So that's why I'm 2 different colors. So the Botox injections, let me use this, were like here and then like one in the middle, right? So this, I can't scrunch. This is all frozen. And this dropped. So before, my eyebrow like was like up here. And it was pretty much straight across, right? So this dropped because these muscles are numb. And this one. Because I got one like right here. It wasn't low enough to like freeze this. And I have like villain or like Spock brows. There are some that are significantly worse. But I look real mean and judgmental. And this bothered me a lot at first because the thing is, I don't actually raise my eyebrows that much. I have a pretty like a neutral face, which is why I didn't really have any forehead wrinkles to begin with. Like, you get injections here sometimes for like those 11 things if you're getting cosmetic Botox. I didn't have 11s. So like, I don't really have forehead wrinkles because I'm not expressive. That's why, yes, I have signs of aging just for being 35, but I don't have severe crow's feet because I don't have an expressive face. But this was so severe and drastic to me in the beginning that I hated it. And I was going to ask her to move that injection down a little. But something you can have if it's not targeted correctly, I'm going to try to do this without my glasses, is if this is like how this dropped. This can drop. And I don't want that. I would rather look like this than look like this. I don't want like hooded eyes until I am older and my eye just like naturally drops. But something that has been interesting is like doing my glasses like straight up, took my makeup off. Doing my makeup because I already had a lot of lid space to work with, but I have so much more. But then like my eye is kind of angled now. It's odd. So I've had to kind of relearn how to do my makeup. So those are the unimportant, unintended side effects of the Botox, but it is something I wanted to discuss just because it's part of it. It was things that I wasn't quite aware of, and maybe you're someone and that would like really bother you. You can ask to not have it between the eyes at all if like you're really uncomfortable with that. But for me, I don't want to mess with a good thing. Everywhere she placed it was important, and it has improved my life so much that I don't care how ridiculous I look. I don't care if I look like Cruella de Vil or Ursula. Like, I do not care because I have my life back. Now, it also helps to have bangs, so like even if I'm over here, like, you can't really see it. But truly, all I care about is that I'm in less pain and I can eat food. The other thing I had to do is I had to stop eating fiber altogether because that's one of the treatments for gastroparesis. You can't have hard to digest foods because your stomach's already not emptying. So I have been on a very limited bland diet for months now, which has not been fun. So the fact that I'm getting all those things back, like I'm able to cook proper meals and I'm able to eat proper meals, has been fantastic. So this is truly a life-changing situation, and I'm very glad that my insurance approved it. I'm very glad that it's working, and yeah, that's just been my experience with round one. Like I said, I meant to say something I'm gonna try next time to see if it helps. People said if for like the first couple of hours after you get it, you just like crinkle your brow a lot, it won't freeze this as much. Like, it'll still be frozen, but it won't be like as severe. So I'm going to try that next time. It won't move it around, so it'll still be in the correct spot, but it will just keep your muscle from totally going numb. That's what I heard anyway. So I'm going to try that. You just don't touch it. Don't touch any of the areas at all, like after you get it done. It was something I did forget to add. You're not supposed to have like a facial or do anything like that for 7 days. And then when it comes to like massage, like on your shoulders or your neck, that is 2 weeks. So as long as I'm not touching here, I should be okay to try to, if my brow even unfreezes, I still have a month before I go for my next round, but we're still totally frozen in there. Nothing is moving. And that's all I have. Thank you so much for watching. If you have any questions about the Botox thing that I might have forgotten, please ask me down below. I would love to answer any questions. If you like this video, please give it a thumbs up. Consider subscribing if you haven't already, and I will see you guys next time.